join us today. Before we get started, I want to make sure our technology is working for us. If you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Thank you so much. Yes, okay, great. Looks like we are good on technology. I do have a couple reminders before we get started. Reminder number one is that we have additional presentations as part of our 2021 Virtual Wellness Fair. Therefore, if you haven't set up a reminder for any of our upcoming webinars, I invite you to do so through the Hidalgo County Wellness Program Fair website. Our second reminder is that you are on listening mode only. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will answer them during our Q&A session at the end of the presentation. At this point, I have the pleasure of introducing our guest speaker for today's presentation, Ms. Diana Hualpa. Diana Hualpa is a global health professional focused on improving the health of the population through statistical analysis and the development of community programs. Ms. Hualpa has a Bachelor of Arts in Political Science and a Bachelor of General Studies with an emphasis on chemistry, biology, and medical Spanish from the University of Texas Pan American and the University of Texas Rio Grande Valley, respectively. She obtained her Master of Science degree in Global Health and Social Justice from King's College London in the United Kingdom. Her academic interest lies in the area of the social determinants of health, quantitative research, and public health. Hualpa served as Hidalgo County Wellness Program Coordinator from 2019 to 2021 and is currently serving as the Program Manager for the American Rescue Plan Act for the Department of Budget and Management. Without further ado, I pass it over to you, Ms. Hualpa.
Thank you so much, Diana, and thank you for everybody that is joining us at this point. I'm going to go ahead and share my screen just so that we can go ahead and start the presentation. It's really exciting to be on the other side of this presentation. Usually, Diana, as you know, I'm usually introducing the host, but it's a topic that I feel very passionate about, especially everything that has to be regarding the brain, mental health, but also neurocognitive disorders is something that I feel very passionate about. So I'm happy to be here and be able to share some information regarding the topic. So let's go ahead and start. I'm going to go over some of the different aspects that we're going to cover through this presentation. And the first one is, what are neurocognitive disorders? We're going to answer that. Then we're going to go over the etiology, which is what are the causes or potential causes for neurocognitive disorders. And then I'm going to discuss briefly the prognosis. And then we're going to discuss whether or not neurocognitive disorders are preventable or not. Perfect. Let's go ahead and start. So neurocognitive disorders are disorders that involve impairments in cognitive abilities such as memory, problem solving, and perception. And I do want to emphasize that in the diagnostic and statistical manual of mental health disorders, which is usually known as DSM, and there's different versions, but in DSM-4, it was previously classified as dementia, delirium, amnesia, and other cognitive disorders. But in the current one, which is DSM-5, it is classified as neurocognitive disorders. Now, one of the things that I do want to emphasize on that is that usually before it was kind of used as a synonym, neurocognitive disorders and dementia, but that's incorrect. It is not the same. It is associated, and we're going to discuss a little bit on how that association comes along, but it is not the same. So I do want to clarify that a little bit more. Now, let's go ahead and discuss two different types. So there's two. The first one is the delirium, and the second one is the major and mild neurocognitive disorders. And for the purpose of this presentation and the time that we have, I'm going to focus more on the major and mild neurocognitive disorders. So right now in the next slide, which is the potential causes, the etiology of these, I'm going to be talking about the major and mild neurocognitive disorders. So there are different causes or potential causes for these. Number one is brain injuries. So brain injuries caused by a trauma, potentially brain bleeding, some type of concussion, also breathing conditions. If you do have low oxygen levels, or for example, high carbon dioxide levels. The third one is cardiovascular disorders, such as heart infections, stroke, and of course, we do have our degenerative disorders, which are Alzheimer's and Parkinson's disease. There's three other potential causes, which is metabolic causes such as kidney, liver, and of course, the drug and alcohol related conditions. There is studies that have confirmed that there is a relationship between the alcohol and the drugs usage to potentially causing these conditions. And the last one is infection, which is meningitis and of course, blood poisoning as well. I do want to mention that it is not only that, let's say that one of these is going to cause the neurocognitive disorder. It can be also a combination of them or multiple of them or something that is not unspecified. So there's different other options that can be causing this. For example, like HIV infection, etc. Let me go ahead and talk a little bit about the difference between mental disorders and neurocognitive disorders, because I feel it's important that we touch on that topic. Usually both of them are related to the brain function and are involved with that, but they are very different things. So for the mental health disorders, they are basically most specified on abnormal thoughts, perceptions, emotions, behavior, and even the relationship with others. And on the other hand, neurocognitive disorders is more on the cognition side. So some of the intellectual features that we're actually going to be discussing on the next slide that are being affected. There is two specialties. So for example, just for information for mental health disorders, we do have our psychiatrists, which are the specialists on that topic. And then for the neurocognitive disorders, it is neurologists that we will have to visit in order to get additional studies for these type of conditions. Now, let me go ahead and talk a little bit about the potential symptoms that can be present on a patient that has been diagnosed with a neurocognitive disorder. And the key word here is going to be progressive. But the symptom is progressive decline in individuals' functioning. And why is it important that we specify or that we focus a little bit more on that word progressive? First of all, because it has to be something that is not developmental, which means that the patient or the individual was not born with this condition. With this, for example, let's say an intellectual challenge that they might have, that would not be classified as a symptom for cognitive disorders, because if the patient was already born with that condition, then that's not the case. However, we also want to specify on progressive because it has to be something that we start seeing a decrease in as time goes by. Now, there's different types of sections that are being affected on the individual's function. And the first one is the memory. So for memory, there's different types of memories. We do have our short-term memory, the long-term memory, semantic and autobiographical memory. And all of those are starting to be affected when patients they develop a neurocognitive disorder. The next one is reasoning. And it goes a little bit more on the being able to plan, being able to make decisions. It also relates a little bit with memory, but more on the working memory, which is the memory that we use when we are doing some actions in that specific moment. Now, we are also, on the reasoning section, is also the way that we respond to feedback. So how do we react to that? The third category of symptoms is the intellectual ability. And that refers a little bit more on, for example, being able to find the words, also the object naming, the fluency, the grammar, the syntax. So that's what it relates to intellectual ability. And of course, we do have those social skills. So being able to recognize emotions, being able to socialize, and being able to feel comfortable in a social setting, of course. Now, a lot of these symptoms do overlap with some mental health conditions. And that's okay, especially, for example, with mental health disorders such as schizophrenia, depression, and psychosis, they do overlap. However, we do need to be super cognizant that not because one presents a mental health disorder is going to present neurocognitive disorder. Now let's talk a little bit about the prognosis, and this is more of what are some of the potential outcomes that a patient that has been diagnosed with a neurocognitive disorder can have. So there's different options, and there's also different, it depends also on the root of the potential cause of this disorder. So if it is caused by a degenerative disease, they are treatable, but they are not curable. And that's something that, of course, I do want to emphasize. The most important thing is going to your physician, especially your primary care physician, and so that he or she can refer you to the specialist. Now, the other option is if it is caused by an infection, trauma, or a cardiovascular disorder, they can generally be treated and potentially be recovered from. However, if they are not managed properly, they will definitely worsen over time. So that's something that we do want to emphasize. And the presentation that I'll continue to share right now, it's going to focus a little bit more on the prevention, because that is the emphasis at least of our wellness program. And there are actions that we can definitely do. But let's go ahead and answer the question whether or not neurocognitive disorders are preventable. And the answer to that question is that research still needs to be continue to be done. There are associations. There's no some vaccine against dementia, for example, or against Alzheimer, but there have been some research, especially, for example, in the UK and also here in the United States, where there has been a decrease in the probabilities of developing a neurocognitive disorder if you have a healthy lifestyle. Now, but for that, I do want to touch a little bit more on the risk factors. And for that, I think it's important that we divide them always into sections. The first one is genetics or family. So if there is a family history of patients or members of your family that have developed a neurocognitive disorder, the likelihood is a little bit higher for that family member to develop a neurocognitive disorder. Age as well, and those are age and family history. Those are two factors that we cannot change, right? However, there are some that we can definitely take action, and those are the ones that I would like to focus on. Now, I do want to mention on the age, going back a little bit, that aging, and developing a neurocognitive disorder as we age, it's not normal. So it's not something that it is expected. There is a higher probability, but it's not something that because I'm getting older, I'm gonna develop Alzheimer's or I'm gonna develop Parkinson's. That is not the case. It just increases the probability, and that's why they are called risk factors. Now let's go ahead and talk a little bit about the other ones. So the ones that are lifestyle related: alcohol consumption, poor sleep patterns, obesity, smoking, high blood pressure, high cholesterol, and of course, diabetes. And we did have a couple of presentations already on diabetes and sleep patterns. So I think it is very important that we continue to make sure that we practice a healthy lifestyle. But let's go ahead and emphasize a little bit more. The first one is exercise. So the recommended time to exercise is 150 minutes per week. Usually, it also depends on the person. And what I always like to tell the employees is that we need to do something that we enjoy, something that we like. And either it can be 30 minutes for 5 days a week, or you can do 60 minutes for 3 days. It just depends on, of course, your schedule as well. I do recommend going to family walks, doing outdoor walking. And of course, we do have our free fitness classes and the Precinct 2 indoor sports complex as well. The third one is a balanced diet. So it is very important that we take care of our diet, especially having a diet that is rich in vegetables. And one of the things that I do like to say is that we don't need to change our diet completely. And that's something that I try to emphasize on. We don't want to change what we do. We just want to improve it. And hopefully we can do it step by step. When we do drastic changes, usually we're going to go back to our old habits. So it's very important that we do it progressively. And then instead of removing probably unhealthy foods, we can start incorporating more greens, more fresh products, more fruits, more vegetables to our meal. Now, there has been studies found that foods rich in vitamin E and vitamin C decrease the probability of developing a neurocognitive disorder. And in the case in the vitamin E, it is, for example, sunflower seeds. For vitamin C, it's more your orange, your lemons. And the reason of why is that is because vitamin E, it has a lot of antioxidants. So that's gonna help you with the aging process. And vitamin C actually helps protect the development of the brain. So that's why it's really important and good that we have foods rich in those two vitamins, especially. Now, I do want to touch on the Mediterranean style diet. There has been a lot of research done, especially there was a study done in Barcelona. Very interesting now how that improves or potentially reduces the probability of developing a neurocognitive disorder. And it's something that is really interesting. It does focus a little bit more on having food rich in protein, especially fish, for example, tuna, and of course, a lot of vegetables and fruits as well. And just as we briefly covered before, reducing the alcohol consumption is really important. It definitely reduces the probability of developing a neurocognitive disorder. The next one is staying socially stimulated. It's really important for these type of conditions that we stay active in our social life. So I know, especially right now with COVID-19, we needed to stay at home, right? We needed to stop having those interactions that, especially particular to our culture, we were used to it. So that was kind of like a drastic change for us. But it is important. At the end of the day, we are social human beings, and we need those connections in order for us to have a healthy and overall good well-being. So I will definitely recommend on prioritizing on socializing with your friends, with your coworkers, with your family members, and also continue to enhance your communication skills in your everyday relationship. My mindset is of there's always a we can continue improving in everything that we do. In this case, with the communication skills, especially right now, and for example, for children that were at schools that they did not have that opportunity to socialize, it is very important that we continue to put ourselves in different social situations where we can continue to improve those communication skills. And the next one is staying intellectually stimulated. I think it's really important, and because it is related to the brain, that we stay active. We play, that can be playing board games, creating art, playing an instrument. That's something that is really important. Also reading. I do want to emphasize on reading. That really helps. One of the things that, for example, I personally like to do is some math problems, or for example, Sudoku. That's one of my favorites, and I really, really like it. So there's different things that we can do to actually prevent developing one of these neurocognitive disorders. And I think that's one of the things that I want to emphasize. And of course, I do want to reiterate the importance of going to your primary care physician, because we do need to make those screenings, especially your annual physical. We do want to go to the doctor every single year and make sure that we have all the analysis and all the tests done so we can prevent these medical conditions, especially because there are some factors that can be preventable. For example, the high cholesterol and diabetes and high blood pressure. Those conditions are manageable. So if we take the medication and we follow our healthy diet and we exercise, those can be controlled. And in the case of diabetes, as we heard from Dr. Maria Colan, it is reversible, right? Of course, if it is the diabetes type 2. So I just want to emphasize on that. And I do really appreciate being here, Diana. Thank you so much.
Excellent. Thank you so much. I'm going to go ahead and share my screen. It allows. Okay. Alrighty, so let's go ahead and look at some of these questions. I know we got a few of them in the Q&A. So somebody asked, what are a few mental exercises you suggest?
Absolutely. And as I mentioned, I think one, at least one of my favorites, it is Sudoku. I love it. I think it really challenges the brain. There's different levels at different stages that you can select. But like I always say, it's always, we need to do something that we like and that we enjoy. That way we can keep doing it and we always go back to doing it. But again, reading, it's another one really good. The crossword puzzles as well. So yeah, there's different options, and definitely I think we need to find the one that works for you. Mhm.
Definitely, definitely. Yeah, those are great suggestions. I know definitely finding one that works for you is really important, because I know Sudoku can be challenging for me.
Yes, absolutely.
Someone else asked, can you elaborate a little bit more on the Mediterranean diet?
Absolutely, yes. So there's different, I guess, different foods that they emphasize on, but especially, like I mentioned, is whole grains, vegetable, legumes, fruits, nuts, seeds. So there is that specific more on the vegetables and whole grains. Of course, also another good point to add to this Mediterranean diet is the olive oil. Is one of the ones that is the main source of added fat. Mhm.
Excellent. Awesome. Yeah, that sounds like a great balanced diet. Someone asked, what would be considered a heavy drinker?
That's a good question. And I think actually we haven't touched on the alcohol consumption that much. So I think that's definitely a good question. So it depends on men and women. So for men, it's 4 drinks per day or 14 drinks per week. And for women, it's 3 drinks per day or 7 drinks per week. So there's definitely some studies that have it done in terms of how, for example, drinking a glass of wine can help to decrease the probabilities of developing cardiovascular disease. And of course, that's something that the studies have shown. However, we want to make sure that we're not drinking in high quantities, and especially that we don't go to that section where it says, where we already classify as heavy drinkers, which is those 4 drinks per day or 3 drinks per day for women.
Right, right, definitely. So let's see, we have another question. What is the age that people develop symptoms of these disorders?
That's a really interesting question. And I do want to emphasize that although age, it is one of those factors, it is not necessarily related or directly related to aging. So neurocognitive disorders can start at different ages. However, it is more likely that you develop it at a later ages, so over 60 years old. However, as always, I do advise you to visit with your primary care physician. That way they can definitely do further studies for each an individual case, because I think we do need to emphasize that each patient is different and each person is different. So we develop different symptoms, we develop different at different stages as well of life. Especially also, if I can add to that, Diana, one of the other potential causes was trauma or a concussion. So if a patient had one of those situations, then probably it's going to be a little bit earlier in life, right? But it just depends. So as always, visit with your primary care physician.
Right. Let's see, we have somebody that asked, is Alzheimer's hereditary? Or I guess would, those certain degenerative disorders, would some of those be hereditary?
That's a great question. And no, it is not hereditary. It's just that it increases the probability. So I think it is important that we emphasize that. It just increases the probability, but it's not. So because let's say that my father had Alzheimer, I'm going to develop Alzheimer. That's not the case. It just increases the probability. And having a good, healthy lifestyle definitely helps to reduce those probabilities.
Okay, awesome. Yeah, we still have time for a couple more questions. Let's see, somebody put, what if someone is already diagnosed? How can we help them? It was very hard for their grandfather and they didn't really know how to help or how to assist with that, which is a great question.
That's a great question. Thank you so much, Diana. Just with any other condition, I think when we, I guess as family members are on the other side of the spectrum and we are here mainly as supporting someone that has the condition, it definitely takes a toll on us. So I think, and I am a firm believer that when you want to help someone, first you need to make sure that you are in the right mindset, that you feel okay and that you feel safe, and that it is not necessarily your responsibility to assist. Of course, we do want to assist, and especially when it's someone that we really care for and we love, we definitely want to be there for them. However, we do need to take that pressure from ourselves. I think that's something very important. Now, the second thing on that, we definitely need to seek help. When it is a family member that is being diagnosed either with this condition or, for example, mental health is another one that really takes a toll on the family members, we definitely want to seek support and have a good and a strong social network that can provide us resources to support that other individual. So, for example, I do highly encourage everybody to visit with a counselor, have someone where we can talk to that is going to be unbiased, that is going to listen without being affected. Because what happened is that when we sometimes, for example, share some sort of situations that we're going through or something like that to one of our friends or our family members, they are directly involved in the situation. So it is easy to get a little bit hurt sometimes, but when you talk to a counselor, that counselor is someone that is going to stay unbiased and that is also going to remain unaffected directly about the situation that is going on. And I think just to add a little bit more to that question, is always one thing that we can definitely make sure for those, how can we help those patients, is making sure that they follow the treatment and that they go to their visits. I think it's really important that they always go to their physician visits.
Mm-hmm. Definitely. Yeah, those are great tips and resources. Yes, thank you so much. We do have somebody that asked, is 1 glass of wine a day considered heavy drinking?
That's a great question. And no, 1 glass of wine is not considered heavy drinking. So again, for women is 3 drinks per day or more. Mm-hmm. And for men is 4 drinks per day or more.
Mm-hmm. Thank you for that. I think we have one last one here. We have someone that said, regarding the mind stimulating exercises, as in all practice, consistency is key, correct? But overall, it's a mix of all practices and wellness. Is there such a thing as too much, I'm assuming, mental exercise that would cap and in turn damage the mind or brain process?
I think that's an amazing question. Thank you so much, Anna. So I guess it's kind of like a two-section question, and let's go ahead and break it down a little bit. So the first part was regarding consistency. And yes, absolutely. Consistency is key, and it's not only key for mind exercises, but all sort of activities that we do, including, of course, physical exercise. It is not recommended that we exercise for, let's say, 2 hours, very intensive, and then don't do any exercise the rest of the week. We definitely want to make sure that we stay consistent and that we do exercise at least 30 minutes per day, right? Mm-hmm. And the same thing with the mental health exercises. It's not something like, let's say that I'm going to go ahead and read a whole book for 1 day and then don't do anything for the rest of the week. We definitely want to make sure that we stay consistent and doing different things. Now, it doesn't necessarily mean, just like exercise, that for mental exercises, we need to do the same one every single day. It also depends on person to person, but definitely, like I mentioned, is find something that you like and that you enjoy. And that if you need to, for example, read for 1 day, and then in my case, do Sudokus on Tuesday or something like that, that's perfectly fine. You can definitely mix and match with those. It's just something that you enjoy. And then just going back to the second part of this question, is there a such thing as too much exercise that will damage our brain or mind? And I think that's an interesting question, just because we do need to be mindful of the level of stress that we do have. Because just as any other, I want to say, let's say like chronic conditions such as high blood pressure, And diabetes, stress, it is a risk factor to developing those. And because those conditions, in this case, diabetes, high blood pressure, and hyperlipidemia, it is a risk factor to developing cognitive disorders. We do want to be mindful of that. So definitely, like I always say, there has to be a balance. We need to be mindful of how we feel. And it's really important for us that we try to understand ourselves and assess ourselves on how we're feeling frequently. So I wouldn't say that there's a maximum amount of exercises that you can do. However, we do want to be mindful that our levels of stress are not that high, because if that's the case, then we start developing some hormones called cortisol, and that makes our brain to go to kind of like fight or flight action, and then our brain just keeps very active, and then at the end that can cause other conditions. So we definitely want to make sure that we start mindful of that.
Absolutely. Thank you so much. And I think that rounds out our Q&A session for this presentation. I do want to thank you all for joining us this morning. And thank you so much, Ms. Walpa, for giving us such an insightful presentation on neurocognitive disorders. Thank you again for being with us today. I really appreciate your time and your engagement throughout this presentation. And I hope you all have a great day. Stay safe and healthy. And I hope you can join us for the next presentations as well. Thank you.
Thank you so much, Diana.